Gut health, sort of really high level, impacts thyroid health, but the components of that would be thyroid hormone medication absorption. The second one would be via improving gut health, you can reduce inflammation and therefore symptoms, remembering that 70% of your immune system is contained in your intestinal tract, and the immune system uses inflammation as one of the main instruments to perform its function of cleaning things up. So if we're thinking leaky gut, then we're thinking increased inflammation. And some of these symptoms that Laura and others were experiencing or do experience are really inflammatory, and they may not be from the thyroid hormone or the thyroid gland in and of itself. Third point is you can have a improvement in thyroid autoimmunity. This hasn't been super robustly demonstrated, but there's at least, I think, an initial signal. As one example, we discussed maybe a year plus ago, this interesting Polish study that found people with SIBO, small intestinal bacterial overgrowth, did have a modestly higher level of TPO antibodies than healthy controls without SIBO. And another Italian paper that found treatment of H. pylori reduced thyroid antibodies. Other studies haven't reinforced that, so it's kind of mixed in terms of what you find, but nevertheless, I don't think it's hard to justify improving one's gut health in attempts to improve autoimmunity, including thyroid autoimmunity. And then the fourth point here is the absorption of key nutrients. Selenium and myo-inositol can help with thyroid autoimmunity, and they can help to prevent or correct sluggish thyroid, or what's known technically as subclinical hypothyroid. This is where you have a mild elevation of the TSH. Those nutrients don't tend to be malabsorbed, but they're just important to think about. Iodine, I put iodine on the notes here because there was one study from a couple of years back that found people who were adhering to, in the long term, a paleo diet had increased risk of iodine insufficiency. Now, long term, I believe, was defined as a year or longer. And what I suspect is happening here is that people who are going on what I think is a generally healthy diet, the paleo diet, are inadvertently cutting out sources of iodine fortification. Salt, if people are consuming sea salt rather than iodized salt, sea salt is going to be much lower in iodine content than an iodized salt. And then if people are not consuming dairy and grain products, these are also fortified. So what could be happening is people are not getting enough iodine in their diet. And this could be as simple as doing either a Google search for the foods that you commonly eat, or plugging your data into an app like MyFitnessPal or Chronometer and just running a report on, are you hitting your required iodine intake? The nutrients that are really associated with malabsorption specifically are iron and the B vitamins, most namely but not limited to B12. And this is because a subset of people with hypothyroid will also have impaired secretion of stomach acid. And that acid is needed to ionize iron and B12 and absorb it, or also the release of intrinsic factor for B12 is required. But nevertheless, low iron or low B12 can be part of what's happening nutritionally that could lead to these non-responsive symptoms, especially fatigue. Iron is fairly easy to assess via a ferritin test, and B12 is actually a little less straightforward in terms of serum B12 or urinary or blood, what's known as MMA, methylmalonic acid, don't always seem to catch individuals who benefit or require B12 supplementation. So I kind of favor trialing B12 for a month and seeing if you notice a consistent and appreciable improvement in symptoms like fatigue, but not limited to fatigue.